In this video, we're talking about head injury, one of the most common things that toddlers and young children do to themselves. Now, luckily they're designed for impact. They have lovely big foreheads, big back of the heads, and you know what, their heads are a third the size of their body, so that tends to be what they impact with. Now, it is really common for a toddler to be sporting a nice big egg on their head, a lovely big swelling from running into something. Now, I guess what's normal? What's normal is that a toddler will smack into an object, usually a wall or a coffee table, something like that, and they will cry immediately. So there's no loss of consciousness, they just start screaming at the top of their lungs, and you see a nice big, firm to touch egg. They just need a little bit of a cuddle, and then all of a sudden they're like, right, let's get back into it. Let's see what we can do, okay? Get back into the Lego, and they don't want you to put ice on their head because that's just impeding all the fun that they're going to have. That's normal. By all means, you can certainly try and get an ice pack onto their head, but often they won't let you do that. Often wrapping it up in a nice cold flannel is a good way of doing that, or indeed even just a wet cold flannel. But to tell you the truth, often, especially a toddler, they're not going to let you near them, and that's okay. Often it's for our benefit that we like to put that on there. Although ice or cold does reduce pain and swelling. So, what's not normal? When do you need to go and get medical help? It's quite simple. If your child has a loss of consciousness after hitting their head, if they run into something and they are knocked out, they have a loss of consciousness, they are unconscious, even for 5 seconds, call an ambulance. That is a massive impact in a child to actually knock them out. So please, without hesitation, call an ambulance if they have a loss of consciousness. Now, if your child hits their head and they don't have a loss of consciousness, there are other symptoms that you need to look for. Any vomiting after a head injury, seek medical help. If they are dizzy, and you may notice this by the way that they're walking, or an older child will actually be able to articulate that to you. If they have blurred vision, and that's something that an older child will be able to say to you. If they are drowsy, but it's not their normal sleep time. If they have a seizure. If they have what we call a boggy swelling, so instead of that egg on their head being quite firm to touch, if it's squishy, like a kitchen sponge, or quite squashy, then you need to get medical help. That can sometimes indicate that there might be some significant bleeding under there. Or if they just have strange behaviour that's not right for them. If you've got a child who's normally tearing around into everything, and after a head injury, they may be just sitting there being very quiet, or some kind of behaviour that is just not right, get medical help. And always trust your gut. If after a head injury, or really with any type of injury or illness, if you think that something is just not right, please go and get medical help.